All right, good morning, everybody. Thanks for coming. I like to ask everyone, is it anyone's first seminar? Anyone? Awesome. Well, thank you for being here. We really appreciate it. I also want to ask, did anyone still waking up from attending our fundraiser at Brooklyn Arts Center last night? Me too. Well, thank you for being there. We really appreciate it. Thank you for being there. It was a very huge success. We'll share more soon, but even better, it's going to be an annual event, so we're very excited to see it again next year. But my name is Morgan Hooks. I'm the Outreach and Engagement Manager for Cape Fear River Watch. For those that are new, this is our first Saturday seminar series. We do this, as you could guess, on the first Saturday of each month. It's always free. It's always with a speaker local to us, expert in their field. We cover a lot of topics that pertain to the Cape Fear River Basin, not just the water itself, but wildlife, fisheries, and things that are in the river, PFAS. So we'll learn about that today from Dr. Jane Hoppin with NC State. And some other ways to get involved with us. Saturday is a big day for us, so if you like doing things on the weekends. Next week we'll have our second Saturday cleanup at McCumbers Branch in Burnt Mill Creek. Registration for that will go up tomorrow. That's another great way to get involved, very low key. We don't get too crazy with the litter cleanup. We're not climbing or anything, but if you have some free time and you want to come pick up some litter, we get hundreds of pounds at a time. It's a great time. And then our paddle series is back this month. It's almost full, so if you've not signed up yet, I would definitely get on that. We do a paddle on the third Saturday of the month at a different watershed within the Cape Fear River Basin. This month we're doing the Black River. As you might be aware, our river keeper Kemp is from the Black River, so he knows it like the back of his hand. So you're gonna be in great hands, have a great guide, and it's gonna be a celebration of Cape Fear Creek Week. So we're gonna learn a little bit about creeks and tributaries and how the Black River contributes to the whole basin. We also do, I think it might be full now, but we also are doing a guided paddle on Greenfield Lake during Creek Week. It'll be a sunset paddle. It's by paddle boat, so there's only a few spots, but there might be a couple left. If you're interested, I can get you signed up for that. But we'll just be paddling on Greenfield Lake and learning about creeks at sunset, which we don't normally do. So it should be fun. But without further ado, I do want to mention one other thing. Valerie Robertson with Cape Fear Going Green is here. She's going to tell you about a really cool community science festival that's happening this month that our former AmeriCorps member, Savannah Lytle, is actually planning. So do you want to share a little bit about that?
Sure. I know most of you, but I publish Cape Fear's Going Green magazine. Copies in the back as you leave. So we are having the first, our inaugural Community Science Festival will be March 28th in Maids Park. It'll be from 10 to 2. And unlike a lot of festivals, it's not geared to activities for little kids. It's really for adults to learn more about citizen science, also called community science. You don't have to be a citizen, you just have to be human. So that's the reason for the shift. Anyway, this will, there will be lectures explaining the basics of community science, and then there will be exhibitor tables, including Cape Fear River Watch, with organizations that can tell you about specific niche community science projects. So for the lectures, if you have wanted to learn about iNaturalist or eBird, this is a good beginner primer. And if you want to know about niche things like recording sightings of dragonflies or whatever, there'll be something for you there. So 10 to 2, Maids Park, March 28th. The press release just went out on Friday. If you want me to email it to you, give me your email address or call me. And you can also find it by going to the aquarium website. So go to North Carolina Aquarium, Fort Fisher, and it's on the homepage under events and so forth. You can find all the details there.
Sweet.
We will see you there.
We will be there.
All right.
We'll be talking Creek Watchers, our community science program, and also our fellow LJ is doing a ghost forest project on iNaturalist, so that'll be fun. One last thing and then I'll shut up. If you have not seen it, we are doing our second annual Oyster Roast fundraiser next Sunday. It'll be a lot of fun. It'll be at the Cargo District in the alley. We'll have a lot of yummy oysters grown by the UNCW Shellfish Hatchery, some local beer from Mad Mole Brewing, and just a good time. And Kemp is cooking every single one of them, so they will be, he'll be tired, but they'll be cooked really well. I had an oyster for the first time over Christmas, and he cooked it, and it was pretty good. So that's about it for me. So without further ado, Dr. Jane Hoppin.
Thanks. Nice to be here in person. So if you don't know me, I have been the principal investigator of the GenX Exposure Study since it got started in 2017. And we are still going to date. And so I'm going to brush past most of the past 7 years of all the work that we've been doing with people in this room and people from Cape Fear River Watch throughout the basin and where we're going. So, and then there's time for questions at the end. Wait, escape. Oh, look at that, a little bleed. All right, so so what we're going to talk, I'm going to talk about what we did. So to get started in 2017 to 2019, and then kind of where we are now, what we've learned about current and historic PFAS exposure, and how we found some new PFAS hotspots here in New Hanover County, what about health, and where to go next. So some of you may be in that picture, but you know, in June of 2017, some of you in this room woke up to find out that you have been drinking water with Teflon in it for maybe 40 years. And we're not happy about it. And so we got involved. So at that point in time, I was deputy director of the Center for Human Health and the Environment at NC State. And part of our goal is to help respond to emerging environmental health threats. So we wrote a grant in a month and partnered with Cape Fear River Watch, New Hanover County Health Department, and got funded in November of 2017. And now we've grown to 3 different regions. This is my only map in this. And so we're here in Wilmington. We have people who live around the Chemours chemical plant, which is here, and the wells in this region, particularly downwind, have been contaminated. And also people in Pittsburgh who are upriver from the Fayetteville Works plant, but also have high levels of PFAS in their drinking water. So, and so this is really important, as you probably all know, that the watershed provides drinking water for over 1.5 million people here in North Carolina, and that doesn't really account for the people who are served by private wells in this area. So this is a figure of the levels of PFAS that were in the water from a sample in 2015, except for a 2017 data for TFA. And so the important thing to note here is that this is a log scale. So the one that's in lowest concentration, PFHXS, is a little over 10. PFMOAA, which is a chemical like uniquely related to the Chemours facility, is pretty close to 100,000. TFA was also pretty close to 100,000. And GenX is 700 or so here. So we started because we were concerned about this 700. And now we've learned more about this, as well as these ones, which are the ones that are longer lived in the body. So, so what did we do? We started it here in Wilmington in November of 2017. We added Fayetteville in 2019. You may remember there was a hurricane or two in the middle of all of this. So we're really designed to answer questions like, what is GenX? What are PFAS? Is it in me? Does it have health effects? And really we had initial partners. It was like we all got married on the first date because we jumped in. The grant, ready to grant in a month with people you've never worked with before is a fantastic experience if it works. So, and it has worked. So, so the overarching aims of our research are community engagement. So we heard early on, so we have a community science advisory panel. We heard earlier on that we want to know what you know when you know it, even if you don't know what it means. And if you went to some of our early presentations, we found chemicals that we didn't have analytic standards for. So we were showing areas under the curve. We now have analytic standards for those. Does not mean that we won't find other chemicals that we don't. We want to characterize exposure both in people's bodies and in the environment, and then look at predictors of exposure. And then we want to look at health. So what outcomes affect people over the life course? The cohort is people ages 6 and older. So we want to think about things that affect us all, like thyroid function, lipid metabolism, liver function, and we're creating a biological repository that to explore more outcomes in the future. So in 2017, 2018, we enrolled 344 people here in New Hanover County, people who were served by CFPUA. And then in 2019, we enrolled people who were served by private wells near the Keymores facility. And that has in New Hanover County, there's a lot of people. We can just say volunteer. The private well community is in 4 different counties. They're not a group. So to recruit people who had diverse levels of PFAS, we used the data from the DEQ that had been reported from the well testing. So we had funding from NIHS for 2017 to 2019 to do the exposure study. And then what we learned from that, we created the cohort health study. So this is a study that we're following people forward. We had 5 years of funding from 2020 to 2025 to build this cohort. And so we started, we got funded in February of 2020. Also an opportune time to try and recruit people to be in a cohort. And thanks to many people in this room. So we recruited people from Pittsburgh. We had a little over 200 people there, people from the Fayetteville private well community, and people from the lower Cape Fear. And we spent a lot of time also trying to target not just the people in this room, but diverse populations. So we partnered with Warner Temple, AME Zion Church in New Hanover County. We also partnered with the town of Navassa, the local NAACP, so that we could really represent the diversity. We also recruited people in Spanish. So to date, so this is kind of our timeline. So we enrolled a little bit over 1,000 people between 2020 and 2021. And then we resampled people in 2023, and we enrolled the new people we enrolled was to really try to make sure that we included representation of people of color in our sample. And then we resampled people who we didn't measure in 2023. We tried to get that again. So we have over 700 people that we have 2 or more blood samples. And having multiple blood samples gives us the opportunity to look at how the PFAS in people's blood are changing over time, but also lets us look at how the PFAS at one point in time might influence the health outcome at another point in time. So staying in the study, repeated samples gives us the power to really answer the question. And then last year, we added 57 New Hanover County residents who were served by private wells. So we have a final sample size of about 1,200 people that we plan to follow for the next 15 to 20 years. So we enrolled people 6 and older, mostly people served by municipal water, except for the people served by private wells. And our goal for this is that the people in the study are supposed to represent their community. And so by knowing by having people in municipal water, we have an idea of what everybody was drinking in that community, or by private wells because we know what was in individual wells. So our hope is that we could leverage this to create an exposure metric that we could say, like, how long did you live in New Hanover County, and did you drink the water, and did you have a filter, to get some idea of what broadly the exposures were. That work is not funded, but that was really why we've kind of targeted that. We've collected blood and urine. We've analyzed the blood for PFAS and clinical measures. We measure people's height and weight. We administer a questionnaire, and we plan to keep doing this as long as we can. So people range from 6 to 92 when they enrolled in the study. Most people are over 60, and a little over half are women. But what we see here too is that there's a lot of difference in how long you've lived in the area. So people in Pittsburgh, a lot of those people have lived there less than 10 years, whereas people in Fayetteville have lived in their homes a long time, and people down here are some mix in between. And the reason that this is important is it gives us an idea of a diversity of exposure. Like how long have you lived in a place will give you a marker of how long the water you've been exposed. Because everybody has these things in their body, we need to get, we want to be sure that we have variability. So over time, we've measured about 40 different PFAS in serum samples, and we include historically used PFAS like PFOA, PFOS, and also PFAS unique to the Cape Fear River Basin. So these are the ones that are generated at chemours. And all samples were analyzed by high-resolution mass spectrometry. So what do we find? And so this is like, we have a website that has way more detail on all of these slides. But so we started in Wilmington in 2017. We added Fayetteville. We looked for all these different PFAS. We did not expect the PFOA and PFOS levels to be different from the general population. That was not true. That was much higher. So historically used PFAS were at higher levels than the US population. But we also identified new PFAS associated with chemours. And these are called fluoroethers or PFEAs, perfluoroether acids, ether alkyl acids. And the ones that we can see in people's bodies, naphthalene biproduct 2, PFO5-DOA, and PFO4-DOA, are bigger chemicals. So they're going to stick around longer. We also saw some naphthalene biproduct 2 and PFO5-DOA in some people in Fayetteville. And people in Fayetteville, their wells were contaminated by air, so that smaller molecules are going to be more important. We didn't find GenX in anybody's blood. And so these are the chemicals that we have seen in people's blood starting in 2017. And so one of the things, this is a way that we've added up kind of the relative proportion of these chemicals, the relative burden. And so the light blue, or Carolina blue, is the fluoroethers. The dark blue, Duke blue, I can do this because I'm at NC State, right? And no red here, are the historically used PFAS, the ones that are measured by the National Health and Nutrition Examination Survey. And so if you were to just compare the dark blues, that's still like everybody's higher than the US population. But when you look at the relative contribution of the fluoroethers to the body burden, it's much higher in Wilmington than in Fayetteville. But you also see kind of relative proportions similarly in kids and adults. But what the good news is that the levels of these chemicals are coming down in people's blood. And so in 2023, so now we're like 6 years after we started this, 90% of people in the lower Cape Fear region still had PFO5-DOA. Only 18% in Fayetteville. 57% had naphthalene biproduct 2 and 21%. But the levels of naphthalene biproduct 2 are much, much lower than PFO5-DOA. And so this is just a bar chart. So this is the median level. So in 2020, what did PFO5 look like? And the half-life of these chemicals, which is the amount of time it takes half to go away, is about a year. And so it's not quite half there, but you can see that these are coming down because they're no longer discharging these to the river. The CFPUA plant is doing everything it can to discharge it. People have applied filters, all of this. So these chemicals are not in all the daily products that we have. These are chemicals that are really unique to the river. So we see that they're coming down. Similarly for naphthalene biproduct 2. And if you notice on the scale that these are all less than 1 to get started, whereas the other one starts at 4. So much lower on that. So we have also found these 4 PFAS, which are found in everybody in the United States, in almost everyone here. And so these are our original data from 2017, 2018. And so the green is the lower Cape Fear, so here, and the orange is the national data. And so you can see the levels. And so for those of you who don't look at box plots every day, so the middle is the median. The median is 50%. The bottom of the box is 25%. And the top of the box is 75%. The bottom of the whisker is 5%, and the top is 95%. And so what you can see here is for PFOS that the 25th percentile for Wilmington is the 75th percentile for the US population. When we look at PFOA, it's even more extreme. So here's the 95th percentile for the US population. It's below the median level for PFOA. So much, much higher. And PFOA is the chemical that C8, also Parkersburg, West Virginia. And the eyeballing is all of them are higher in people in Wilmington compared to the US population, just on average. So here's what we found in 2023. And again, PFOS concentrations are the most common. And some people have very high levels still. We have a lot of spread in these chemicals, also because these aren't adjusted for age or gender or anything like that. So older folks tend to have more PFAS than younger folks, particularly for these that stay in our body longer. So when we compare, and I just have PFOA and PFOS on these slides, these 3 communities from 2023, so yellow is Pittsburgh. So we oriented this so it goes down the river. Pittsburgh, Fayetteville, Lower Cape Fear, national averages. So we see that PFOS is higher in all of these compared to the US population, and that Pittsburgh and Wilmington seem to have the same spread here. Whereas for PFOA, the people in Fayetteville look a lot like the national averages, and the PFOA looks still a lot like Pittsburgh. So we're writing a paper to kind of sort that out, so we might have answers later. So how are the serum levels changing over time? So on average, they're coming down. So these are data from these are data from the same people. So you can see that the levels are coming down in a 2-year period. Not huge, but it's still like that's what we would expect. Exposure has decreased dramatically, so we're going to be operating under what a half-life would be. And so, these are dropping between 21 and 32%, which is consistent with what we would expect for chemicals with these biological half-lives, which argues that there's been a lot done for source control. And when we presented these data in Pittsburgh, the town manager was like, I thought these were forever chemicals, and these are forever in the environment, but they're not forever in our bodies. So, so that you can, by reducing people's exposure levels dropped pretty dramatically in that time. And probably, and because most of that time window was pandemic time, probably people were mostly drinking water at home. So not a lot of variability from those of us who run around all the places. So, but of course, not everybody's PFAS went down. Some people had some go up and go down. We don't understand why. There may be different sources. Some people moved into a new house. People's bodies change over time. You know, you gain weight, you lose weight, you get sick, you take new medications. So if all of the PFAS are changing, that's probably, it could either be like they're all coming from the same place, so the same thing is happening in your body. If different ones are changing, then maybe there's argues that there are different sources. So what about the past? So we know that we got started in November of 2017, about 5 months after people learned that their water was contaminated. So People started drinking bottled water, discharge to the river stopped, so exposure had reduced by the time we got started. So what we wanted to do was to look at the past, and so this is a paper that came out, and just as I'm looking at it, I have none of the citations on these slides, so they're on our website. So we got 119 samples that have been collected from a biobank from UNC Chapel Hill. And 119 serum samples from Wilmington adults that have been collected 2010 to 2016. So before people knew their water was contaminated. And we analyzed for 56, so more than our normal 41, because we added this suite of ultra short chain PFAS and low molecular weight PFAS. And this work was done in Detlef Knappy's lab by Lan Chen. So in these samples from before people knew their water was contaminated, we found a lot of the chemicals that we would expect to see in everybody, but two more, PFMOAA and PFPRA. So these were ones that we didn't look for before. We also saw that things like PFO5-DOA and naphthalene biproduct 2 were detected in about 90 to 98% of people. And then 5% were detected between 50 and 90% of people, including TFA and PFTRDA. Naming of these is like insane. But so the red ones are ones that we don't know about currently because we didn't look for them before. We saw GenX in about 20. So originally I was like, we need to sort out why we didn't see GenX in the samples that we collected. And even in these samples, only 20% of the people had detectable levels of GenX. So when we compare, and then we also got a water sample that was collected. This is actually water that's just directly downriver from the discharge from the Chemours facility. So the left is the blood sample data, and the right is the water sample data. And so what we see is that PFMOA is, by concentration, the most important contributor to what's in people's blood. But it's the second highest detected PFAS in the water, and TFA is first, and it's second in the water. And then PFOS, so then we have PFOS and PFOA. This one is PFOA, the darker green. And these are the ones that bioconcentrate, but these are kind of low molecular weight PFAS that should be in and out of people's bodies quickly. So how do these compare to our 2017, 2018 results? And so brown is our 2017-18 results. And so we didn't have a lot of samples because we only had 119 and they bounced all around. But you can see that maybe PFOS, like PFOS level, maybe that's higher, but they're kind of the same there. PFO5-DOA, higher. And remember, we have a lot more people in this. This is like 344 people, when these could be like 10 or 12. But we can see that they're pretty similar, except for these two that we would expect to have contributed to concentrate over time. So when we look at our data, so if we, wow, this is a different blue than I expected. So this purple, like these are legacy, these are the ones that NHANES analyzes. So if we were so these three bars are the 2010, 2016. So we already know that the levels, the median concentration was above 20, which is like not good for your health. And then PFEAs added more. The ultra short chain, the TFA and PFMOA, swamped the percentage from these. So these by weight adds a lot more. And so this is the box that we don't know, like what is in these. And that's the next step, is to figure out 5 months later what was in people's blood. So where do they come from? not surprisingly, Fayetteville Works plant, as well as some of the refrigerants. So TFA is a challenging chemical because it is in our environment also as a result of replacing the CFCs that were damaging the ozone layer, and these new generation of refrigerants break down to TFA. And so TFA is becoming a global crisis, and so we don't really know about the full extent of that, but that's the Fayetteville Works plant discharges that, and they tried to get an air permit to discharge that recently. But they're also common in these fluorinated gases. PFMOAA and PFPRA are not. So the main takeaways here are that people in Wilmington had high levels of the ultra-short chain PFAS in their blood and drinking water before June of 2017, particularly these 3 ultra-shorts. We don't know what TFA serum levels are today. PFMOAA, we have like a few samples that were analyzed for PFMOAA, and only 8 of the 252 people from Wilmington had PFMOAA detected at that point, but that would be 3 years later. So what we're planning to do is analyze our data from 2017, 2018 for these 3 for the ultra short chain to get a handle on that. And so the levels of these chemicals are much lower in municipal water now. So we talked about municipal water users. So what about private well users? So there are lots of private well users here in New Hanover County, and these are not people served by CFPUA who get groundwater. These are people who had a well in their backyard and probably didn't have access to the Cape Fear public utility lines. But unfortunately, because the Cape Fear public utility lines were moving river water through and water lines leak, that some of the wells became contaminated with PFAS from the river. And so all of these communities are eligible for PFAS testing under the consent decree. So I'm part of what was formerly known as PFAS Testing Network, now PFAS Research Network, and there was a request for about health effects of PFAS and maybe other chemicals in this community, Rock Hill, which is near Castlehane, and Scotts Hill, which is near Kirkland, and they're about 4 miles apart. And so we enrolled 57 people in May, and we obtained the well sampling data from DEQ for the homes still using private wells. So we expected that the PFAS in people's blood would be somewhere between this elevated level of Wilmington drinking the river and Haines, because people don't just stay at home, they run around town. And also that the well levels of PFAS were lower than historically used. Not surprisingly, we found PFAS in everybody's blood. We didn't find GenX. We didn't look for the ultra short chain. But surprisingly, the levels of most of the PFAS were higher than we see in Wilmington or the same. And so here's for PFOS. And so if you're in the study, you've received these strip charts from us where every dot is a person, every sample, and this tells you kind of, here's the 50th percentile for the US, the 95th percentile, and then the community median. So the median line's up there. And so what we see, so that there's a wide range. So these people all lived in the same house. But this is like, so this goes up to 77. So here's like the US, so Rock Hill, so the median here in Rock Hill, so these are like your neighbors, is like way above the 75th percentile for people in New Hanover County. And the median is about the 25th percentile. There's more variability here, of course, because there are fewer samples, but still, we were not expecting to see much higher PFAS levels. And then when we look at other of these, and these are high molecular weight PFAS. These are chemicals that don't want to stick around in water that long. So PFDA, PFNA, PFUNDA, and these aren't in order. This is 9, this is 10, and this is 11 carbons. And so compared to, like, you know, in this graph, because it's scaled for all of them, you know, New Hanover County doesn't look that different than the NHANES data, but these three pop up higher than both communities. So we don't really know what's going on there. So these findings suggest that there could be other sources of PFAS in this community: firefighting foams, biosolids, industrial contamination. Another thing to know is even though they're eligible for testing under the consent decree, PFOS is not a chemical that's covered under that. These findings suggest there may be other hotspots of PFAS contamination. Biomarkers are not a good way. We don't want to find poisoned people and then figure out why. So that is really a challenge here now, and so trying to figure that out. So, but I get the point of this is that there's going to be other hotspots, and these are, like, we have seen in our, like, 1,200 people, one person off the scale, and they're doing something really weird with, like, solvents, but, like, we've never seen, like, a whole community jump. So there's probably other sources, other places that are impacted. So what about health? This is going to be short, unfortunately. So one of the things that's really critical here is, like, while environmental exposure is coming down, and drinking water doesn't have it, people have lower levels in their bodies, people drank this water for decades. And so just like when you stop smoking, the effects don't go away right away. And that there's no one to sue for this. There's this, like, the people who have been exposed. I lived in Chapel Hill for a long time, so I drank the Cape Fear River for a long time. It's our problem if we have high PFAS. And so the burden of taking care of your health falls on you. So in 2022, the National Academies of Science, Engineering, and Medicine made recommendations for health follow-up of PFAS-exposed people. And so one of the key pieces of the GenX cohort study going forward is to help us understand the potential health effects. So this is the guidance, and there's a link to that. So these data were assembled, published in 2022 based on what had been published by 2021. There is a push in Congress to ask the National Academies to do this again. We were challenged to look at the human literature and see what was, like, strongly associated, looked possibly associated, and things like decreased antibody response to vaccines, dyslipidemia, so that's mainly, like, elevated cholesterol, decreased infant and fetal growth, kidney cancer, breast cancer, testicular cancer, alterations of liver enzymes, pregnancy-induced hypertension, thyroid disease and dysfunction, and ulcerative colitis. So these were kind of the things that we thought about now. Liver disease is probably moving even stronger, kind of where the data are, and breast cancer is still kind of probably on the fence. But there are things that you can do based on this. And so they made recommendations. I was on the panel. We made recommendations that, and we could only comment on what we were charged to do, which are the 7 common PFAS that CDC measures as part of the NHANES. And so if these added up to more than 2, people had some potential for adverse health effects. And if they added up to something 20 or greater, they had an increase of adverse health effects. And so these don't include PFO5 DOA, naphthalene byproduct 2, TFA. And they have regular guidance, so all, like, reduce exposure. So screening for dyslipidemia. And so I think from what I see here is that everybody in Wilmington should be thinking about this. So higher risk, reducing PFAS exposure, you can only do so much, but make sure you get screened for cholesterol, even children, hypertensive disorders, pregnancy, breast cancer, as well as thyroid function testing, kidney and testicular cancer, and ulcerative colitis. So Overall, about 20% of Wilmington in 2023 exceeded 20 nanograms per milliliter. But the fact that the levels are lower doesn't negate the fact that it's higher. And so here's, if we look at 2017 forward, and the top red line is 20. So here we have almost, so this is 50%. So almost 40% of the people in Wilmington exceeded 20. And these include children. And then it goes down, but no one also falls below this like some level of risk. So, and this does not include any of those 7 commons. So people should get health care to be sure that those don't happen. So what can you do to protect your health? Talk to your health care provider about how to best monitor your health. I know like not all healthcare providers know what to say. Get annual screenings. Remembering that testicular cancer is a cancer of young men, so 18 to 40, the age range when men don't go to the doctor. So something to like try and work on. And then during pregnancy, get good prenatal care. So as I mentioned, we're transitioning from an exposure study to a health study. So now we are in step 4. We want to follow people forward over time. And so what are we looking at? We're looking at metabolic outcomes, so lipids. So we published an early paper where we showed that certain PFAS were associated with higher cholesterol levels. Liver function, we have a paper under review where we're looking at PFOA and PFO5-DOA as associated with increased liver enzymes. Thyroid disease, one of the things that makes it hard to study thyroid disease is so many women in New Hanover County already have it. Over 25% of the women in our cohort have thyroid disease. National data, probably 10%. And so if we want to look at how PFAS affect thyroid hormones, we have to exclude anybody who has thyroid disease. So are the people who already got thyroid disease the more sensitive? So we're looking at those two kind of together. And then we're using some of our stored samples to look at metabolic changes or metabolomics on some of our samples. We've looked at immune response. We looked at whether PFAS levels were associated with COVID vaccine titer. We didn't see anything, which is kind of consistent with the literature, but we were poorly designed for that. And we're also looking at cytokines and other immune markers. We're starting to look at kidney disease and look at prospectively how do the markers of kidney disease, such as EGFR, change over time. And we have a little paper where we're looking at bone mass. So if these chemicals affect growth and development, they also seem to impact bone loss over time. So we're starting to look at that. Our study of 1,000 people is too small to study cancer. But we may be able to learn about disease mechanisms, and if we can figure out ways to predict high, medium, and low based on your address, then we're like in business to look at these chemicals, maybe not individual chemicals, and cancer. So that's also a goal. So I'm going to talk about my current life, which is current funding. So someone posted online that the Trump administration canceled the GenX study. They did not. The Biden administration did not cancel it. We wrote a grant that didn't get funded. I do have federal funding for the grant. So it's more competitive. And actually, it's just more challenging because we just don't know what the rules are going to be tomorrow. So here's what we're funded to do today. So I have funding from the North Carolina Collaboratory. It's money from the General Assembly. So we're creating a map of PFAS levels in the basin over time. So you could look at how PFOA is changing. You want to look at women. You want to look at children. We can do all that. We're also going to look at, and we'll be able to add to that. So there's a firefighter study that Heather Stapleton at Duke is leading. So we'll be able to widen it to North Carolina broadly. We want to look at how these levels are changing over time. It's great if they're all coming down, but what are the half-lives, particularly of all of these new ones? We have a grant to update the medical history for all study participants in 2026 and 2027. So we're going to reach out to study participants and call them and ask them to fill out a questionnaire. This is funded by a foundation. That money is in the bank at NC State, so we have that. And then we also have funding from the National Institute of Environmental Health Sciences to get our data and specimens organized and do community engagement. And this is supposed to be funded through 2029. I got like a panicked email last week, like I have to take out all like diversity, equity, inclusion from my grant, so it will continue to be funded. So I did what I had to do, and hopefully I still have 4 years of funding, but that's not how you want to spend science. So, so I have a postdoc, Dylan Wallace, who worked with us earlier, and they're analyzing data to better understand exposure and health. Brittany Paul is working on analyzing stored specimens to look at metabolic changes. And then we have a lot of community engagement. Newsletters, I have some copies here if people want. We have a website, we're translating that into Spanish. We're gonna have community meetings throughout the basin to and not just focus on our study participants, but focus on the impacted communities so that everybody's learning what we're learning. So future funding goals, so I'm hoping to get money from somewhere to support students and postdoctoral fellows to help us continue to analyze our existing health data and maybe analyze some more samples and create materials to share with local health providers about the findings. We'd love to do some more cohort-wide blood collection. That's going to be $1 million a year, and that's a federal grant. And I'm not willing, I don't want to spend our time yet to write this grant not knowing what's happening with the sands. But we're getting ourselves in good position. But we're also working on a grant to develop, to analyze our whole cohort for TFA so we can look at changes over time and by location and also leverage all our health data. So that also will not be a cheap enterprise. So how do we fund this work? So mainly from the National Institutes of Health, and I would say overall I've received about $10 million from multiple sources to do this work. So it's not free. So how can you help? If you're in the study, you should stay in the study, answer our questions. Talk to your elected officials about the study. We've received state funding. We'd like to continue. If you want to donate to the study, you can. This is NC State's having their day of giving. I have flyers if you want to. No need to, but it's just like it helps us to, weather these uncertain times. So in summary, the Cape Fear River Basin from the headwaters all the way to New Hanover and Brunswick County is impacted by PFAS. The full extent of contamination is unknown. We know that the ultra-short PFAS we haven't characterized yet. There are hotspots of PFAS. Levels are coming down in the environment and in people. Health impacts of the exposure are not well characterized, and exposed people bear the brunt for protecting their health. And our goal is to keep doing this for 20 years so we can better understand the impacts of exposure. To learn more, we have a website and email, read our newsletters. We have many people that we work with. Suzanne Lee and David Collier from ECU have been key partners. Detlef Knappe has worked with us throughout all of this, and somehow, didn't even make the slide, but I just like, it's like, yeah, so Detlef, without this wouldn't work. And so we have partners here, Sustainable Sandhills in Fayetteville area and Haw River Assembly. We're funded, follow us. And any questions?
Yeah,